Hi guys, today we're going to be covering first molars, and part of our discussion is going to be covering the universal numbers used to identify first molars. We are also going to be covering the anatomy of molars. We will discuss the eruption date of first molars. We will compare the maxillary first molars to the mandibular first molars, and we'll discuss the cusp of cerebelli.
The universal numbering system is only used in the United States. Numbers 1 through 32 are used to identify permanent teeth. First molars are referred to as numbers 3, 14, 19, and 30. Number 3 is the maxillary right first molar. Number 14 is the maxillary left first molar. Number 19 is the mandibular left first molar. And number 30 is the mandibular right first molar. Molars' primary function is mastication or chewing. At birth, first molars have begun calcification. By the age of 3 to 4, the crown has been completely developed. An eruption takes place between the ages of 5 and 6. The root is not completely developed until the ages of 9 or 10. Let us look at the anatomy of first molars. The crown is the portion of the tooth that is above the gingiva. The root of the tooth is below the gum line or gingiva. The neck of the tooth connects the crown to the root. The outermost portion of the tooth is enamel. Enamel is the hardest tissue in the human body. Below enamel is cementum and then dentin. The gingiva is commonly referred to as gums. As a dental hygiene professional, you should refer to the gums as gingiva. The pulp cavity contains nerves and blood vessels. As you can see from the image, the periodontal ligaments connect the root of the tooth to the bone. Periodontal ligaments are connective tissues that insert into the root cementum and alveolar bone.
You have been asked to bring your colored cards to class. You have a yellow card, a purple card, and a green card. I'm going to ask that you hold up the card that pertains to the correct answer to the next question.
What are the universal numbers used to identify first molars? For those of you holding up your purple card and have answered 3, 14, 19, and 30, you are correct. Let's try another question. At what age do first molars erupt? 5 to 6 years is the correct answer. Some children develop sooner than others, and their teeth erupt earlier, and some develop later, but the age range for first molar eruption is between the ages of 5 and 6. Let's talk about maxillary first molars. Maxillary first molars have 3 roots. There are 4 or 5 cusps on maxillary first molars: the distal buccal cusp, distal lingual cusp, mesial buccal cusp, mesiolingual cusp, and sometimes there is also the cusp of cerebelli. The distal lingual cusp is the least developed cusp. The cusp of cerebelli is a small, non-functioning cusp at the mesiopalatal line angle. It is not always present, and it may consist of only enamel, may not contain dentin. There is no root for the cusp of cerebelli. The maxillary first molar has 6 developmental grooves. The central groove starts at the central pit and runs to the mesial fossa. The buccal groove starts at the central pit and runs buccally between the mesial buccal and distal buccal cusps. The distal oblique groove starts at the distal fossa and runs obliquely. The lingual groove joins the distal oblique groove and travels cervically between the mesiolingual and distal lingual cusps. The transverse groove crosses the oblique ridge. The 5th cusp groove runs between the 5th cusp and the mesiolingual cusp. The 5th cusp is the cusp of cerebelli. There are 3 pits on the maxillary first molars: the central pit, mesial pit, and distal pit. The central pit is the deepest part of the central fossa. It's the junction of the central and buccal developmental grooves. The mesial pit is the deepest part of the mesial fossa, and the distal pit is the deepest part of the distal fossa.
Can somebody please tell me, what is the outermost portion of the crown of the tooth called? Enamel is the correct answer.
Now let's talk about mandibular first molars. Mandibular first molars have two roots. There are 5 cusps on mandibular first molars: 2 buccal, 2 lingual, and 1 distal cusp. The mesial buccal is the largest cusp, the mesial lingual, distal buccal, and distal follow. There are 4 developmental grooves on mandibular first molars: the central, mesial buccal, distal buccal, and lingual. The mesial buccal developmental groove divides the mesial buccal and distal buccal cusp. The distal buccal groove divides the distal buccal and distal cusp. And the lingual groove divides the mesial lingual and distal lingual cusp. There are 3 pits that we should be aware of: the central pit, mesial pit, and distal pit. The central pit is the center of the central fossa. The central fossa, mesial fossa, and distal fossa. The mesial fossa runs from the distal to the mesial marginal ridge, and the distal fossa is from the mesial to the distal marginal ridge.
Okay, what questions do you guys have?